My new initiative, Senate Bill 1322, aims to support people of color looking to enter the mental health workforce, which has historically been overrepresented by white Americans, leading to issues for people of color in receiving culturally competitive care. So some statistics about the ratio here: 78% of mental health professionals are Caucasian, 7% are Hispanic, and 5% are Black. These statistics are from 2023. Mental health care is really difficult to obtain right now in Illinois, and especially if you are in a underserved neighborhood. I represent the communities of Gage Park, Brighton Park, where it's difficult to find mental health professionals that speak Spanish. So when you want your mental health professional to help you, you have to be able to connect with that person. And sometimes it's difficult when you can't speak the same language, or you don't have the same experiences you had culturally or growing up. So that connection is vital in order to have a mental health professional to assist you. So how this bill is going to help is that it's a scholarship program. So I want to attract more young people to look at this profession and say, hey, I want to become a mental health professional, but I want to stay in Illinois and I want to come and help back my community. So after you graduate from a four-year institution, you will be able to now get your student loans paid if you stay in the state of Illinois for at least, I believe, 4 to 5 years. We want to keep all our professionals here in Illinois. We don't want them to leave. We need the help here. So I'm looking forward to getting support for my colleagues to try to get a good appropriation for this new scholarship program. So this is a way we're looking at getting more young people into this profession.
Mental health and behavioral health issues have touched us all in all of our districts. Personally, I've had in my own family, we've sought mental health care, behavioral health care for people in my family. And let me tell you, it is hard. For people who are not equipped in how to find care. It's easy to find care for regular health. It's not so easy for mental health care. And in our district, we had a roundtable discussion. One of the biggest problems with mental health care is the shortage of mental health care providers. It's hard to find them because a lot of times they're not there. My bill, are trying to address those shortages. Senate Bill 1225, in a small way, does just that. Currently, mental health care providers are eligible for child care through the Department of Human Services Child Care Assistance Program if their household income is below 225% of the federal poverty level. This means a family of 4 would qualify if their annual income is $72,000. Senate Bill 1225 modestly increases that to 300% of the federal poverty level. This would in just a small way, increase the eligibility for child care assistance, freeing up professionals from making that decision of whether to offer their care or to stay home to watch their kids. Taking these necessary steps will move us closer to our mental health care accessibility and workforce goals.
Both in this state and in this country, we're facing a series of mental health crises, and all of us here are determined to take this crisis head on, to make sure that the people we represent have the best care and support possible. Illinois is taking bold steps to ensure individuals in crisis receive the care they deserve. Mental health services are under increasing strain, and we must act now to expand access and improve response systems. Senate Bill 2500, a measure I'm sponsoring, would provide a structured, accountable approach to meeting the rising demand for mental health care. This is about extending and strengthening a bill we passed just a few years ago called CESA. Under the measure, the implementation deadline for CESA, Community Emergency Services and Support Act, would extend to July 1st, 2027, allowing for a more thoughtful and effective rollout of services. This extension would allow for better conditions, more comprehensive training, and increased accountability in the delivery of behavioral health services. By refining our approach, we can create a sustainable, well-equipped mental health response system that meets every community's needs. Senate Bill 2500 introduces new training requirements for mobile mental health relief teams, ensuring responders have the skills needed to handle crises effectively. A well-trained workforce means better outcomes for individuals experiencing mental health emergencies. Investing in mental health professionals is critical to building a compassionate and competent response system. This initiative, along with the initiatives of my colleagues, would strengthen our commitment to public safety and well-being by prioritizing professional and compassionate care. Illinois could serve as a national model for how to implement a crisis response system that truly meets the needs of its residents. Passing SB 2500 would set the foundation for a mental health system that is accessible, effective, and sustainable.
This bill is very simple. It would prohibit scenarios where people that are in treatment with mental health providers are limited to one visit a week or to a few hours on a given day, again, because of the recommendations of a for-profit actuarial model that doesn't have anything to do with anybody's treatment or anybody becoming healed or treating their underlying mental health condition. This legislation is very important because patients and their mental health providers should be the ones deciding the best time of the week for people to see each other, the frequency of the appointments, not the insurance companies. This bill was crafted in collaboration with several of my constituents who have consistently brought this issue forward to me, and it's high time that we did something about it. For a moment, I want to ask you all to put yourselves in the shoes of someone who is living through a crisis, someone who is struggling with an anxiety disorder, somebody who is struggling with schizophrenia or a number of other chronic mental health conditions, who then all of a sudden, when they go in to see their therapist or their provider, is told, I can no longer see you at Monday or 9 a.m. I can only see you Wednesday between 2 and 4 p.m. And the person actually is working in a dynamic job where they don't control their schedule and they don't control their hours. And so that person no longer is able to seek care with people that are a good fit for them, again, because of profits and because of insurance companies that should not be driving the wheel when it comes to the mental health crisis that we are seeing play itself out in every corner of our state, in every single Senate district, and indeed everywhere in this country. Senate Bill 2287 would allow anyone who is currently in mental health treatment with a therapist or a substance use treatment provider or other professional, the opportunity to stay working with that person if the insurance company no longer contracts with their provider. This is a big, not even a donut hole, this is a major service gap issue that we're seeing all across the state. Where people have oftentimes waited 6 months to get off the wait list to see a therapist that's a good fit for them because of the reasons that my colleague Senator Cervantes mentioned earlier. They're likely a culturally appropriate good fit for that person in the context of where we already have very few mental health providers who oftentimes are non-Caucasian. We also have another scenario where insurance companies are just willy-nilly looking at an actuary or a spreadsheet and deciding that they're going to maximize their profits over people. And I think that that's a disgrace. I think that we ought to tackle the insurance companies. And I think that Senate Bill 2287, which is supported by the Illinois Behavioral Health Association, Thresholds, and a number of other advocacy organizations that care about mental health, is the right bill at the right time. And so a couple of other points on that. This bill would provide so that patients can see any mental health provider, whether or not they're in their insurance network. That is the big deliverable of this bill, that the networks are not going to control and piecemeal and sort of partition who can see who based on the actuarial recommendations of some consultant that probably has never set foot in Illinois. That is a bill that I'm proud to carry, and I look forward to that bill being assigned to committee and getting a discussion going around how we can bring mental health to people who, again, I want to emphasize, are already in treatment. They are already seeing somebody that's a good fit for them, and they should not be booted or dislodged from working with that person because of profits.
Thanks for watching this video. Please like and subscribe to keep up to date with news from the caucus. For more information on what the senator is working on, please follow them on social media using the links in the description down below.